PHL17 presents In Focus, a look at the issues affecting the Delaware Valley. Now your host, Steve Highsmith.
Something new has been forming in the effort to understand and treat autism. A new Autism Institute intends to make remarkable contributions in the arena of autism spectrum disorders. Good morning. I'm Steve Highsmith and welcome to In Focus. Autism, the umbrella term for a spectrum or range of developmental disorders, affects about 680,000 to 875,000 children, maybe more. The latest Centers for Disease Control report estimates 1 in 88 children lives with some form of autism. Up to 4 million adults are affected in the United States. The new AJ Drexel Autism Institute is supported by Drexel University School of Public Health. The school is a national coordinator of EARLI, EARLI, the Early Autism Risk Longitudinal Investigation, which is also one of the National Institute of Health's Autism Centers of Excellence research projects. With me is Dr. Craig Newschaffer, professor and chair of Drexel University's Department of Epidemiology and Biostatistics at Drexel University School of Public Health and director of the new AJ Drexel Autism Institute. Doctor, thanks for being here.
Steve, my pleasure.
So, President Fry announced about a year ago or so that this would be created. Now we're in a year in which you're actually going to see it open.
That's right. Our plans are to sort of open the doors in July. We're entering sort of a 5-year startup phase where we hope to be building our team and really getting going to address the challenge that you alluded to in your opening comments.
And you're the director, so what does that entail?
Well, I'll be providing sort of the vision and the leadership for the Institute. I think over the next year, really my job is very exciting because what I get to do now, because of the great support we've had from the university, is reach out and try to bring some of the leading scientists interested in autism and who want to take a public health perspective at doing science to try to answer some of these questions. And
so what do you have to decide? Are you in the process of deciding these are the areas of research that we're going to go into? Because you can go 180 degrees easy.
Yeah, we've actually given that a lot of thought, and I think that the theme that's really going to drive what we do is this idea of taking a public health science approach to autism. And to think about that, when I talk to folks about this, I think there are two concepts to keep in mind. One is the idea of prevention, and the other is the idea of populations. So what a public health science approach wants to do is it wants to find ways that can prevent the morbidity and disability that's associated with a condition, and this can be cancer, heart disease, or in our case, autism spectrum disorders. And from population, what we want to do is we want to think about broad communities. Physicians, clinicians, basic researchers, they're very focused. You know, the basic researcher is focused on understanding autism in a lab dish. The clinician is very concerned, and appropriately so, with the patient that's sitting across from them. What we want to do is do research that really thinks about the community of individuals in the Philadelphia region and nationally who are affected by autism.
And so how do you develop strategies for that? Do you have target goals? Do you know what your goals are? Or do you just start working down this path and get scientists and other academicians get together and say, well, this is what I think might work?
No, we have sort of an overarching strategy, but I think it's a little of the latter too. You know, hopefully the magic that happens when we bring people together and we really start, interacting. Hopefully that could certainly take us in some unexpected and interesting directions. But really, what we think about, and again, going back to the way we sort of conceptualize this idea of public health, is we think about primary, secondary, and tertiary prevention, and that just means primary prevention means understanding the root cause of a condition and seeing if there are causes that can be changed. So and this is the research that I've been most active in over the past decade, trying to understand, are there risk factors for autism that might be avoidable? And if we can identify those, then we can come up with recommendations that might prevent some of the morbidity associated with autism because folks can avoid these risk factors. So that's at one end. Secondary prevention is the idea of recognizing a condition as early as you can so you can get the best services in place as soon as possible. And there's been a lot of interest around autism and early identification. And we want to really promote that kind of research, and especially thinking about the ways that we can spread early identification, again, throughout the diverse communities in the United States. And then tertiary prevention is the idea of treatment. So from a public health perspective, again, it's really about access and building systems and understanding how systems can better promote equal access to treatment for everybody.
Well, for parents out there who are very much concerned about their own children who may have been diagnosed, and for parents who are worried that they may have a child that could be at risk for this, particularly when they see this 1 in 88 number nationally, or when they see New Jersey's number, when you break it down by state, of being 1 in 49, or when they see a number nationally of boys being 1 in 54, because boys are still, what, 4 or 5 to 1 more likely to be diagnosed as having autism, correct? So when they look at that, they say, oh, that sounds all good, but tell me a little bit more how it's going to really help me. And so let's deal with I think the second one you mentioned, for example, which is, the diagnosis of it. And we've heard different things over the years about, well, it'd be great if you can get that 18 to 36 months, but we still have cases of 4 and 5 years. Is that still the rule today? Or can we even get earlier than 18 months?
Very, very interesting. I mean, I think that it's quite possible that we may be able to get earlier. Where we are, though, with the science and the research on the very earliest of diagnosis is at a little bit of a different stage than sort of this public health approach. There are a lot of good scientists around the country who are really trying to come up with, under sort of these tightly controlled experimental conditions, can we take babies as young as 6 months and see whether or not, maybe by tracking where they look in response to certain social cues, can that be a predictive marker of autism? And that research is going on right now. But those techniques aren't really ready to be rolled out to clinical practice yet. But there are tools that have been developed over the last decade, validated, studied under ideal conditions, that really where we are right now is we want to find ways to get them in the hands of pediatricians, educators who work with kids at the youngest ages so that they can recognize autism validly and reliably right now. And let's talk about the types of autism, because there may be some changes going on with that. If we could take a look, generally over the last number of years, autism has been categorized into 3 general categories: autistic disorder, Asperger's syndrome, and atypical autism. Before we get into the potential changes in those, what could you say? How can you describe each of those? Well, for a behaviorally based condition like autism, and there are of course others out there, the diagnosis is an art as much of a science. We need sort of categories and labels so that we can begin to think about how to best serve families. So it's very, very important. But from another perspective, we've understand, and I think you even alluded to it, the term autism spectrum has been out there and is out there for good reasons, because the symptoms of autism and the challenges really, range over, have a range. And they have different axes, right? We talk about social impairment, communication impairment, insistence on sameness. All those domains can have different levels of severity, so you can think that there's sort of an infinite combination of the way those symptoms interact. And a lot of parents of kids with autism, like to the saying, well, if you've met one kid with autism, you've met one kid with autism. But still, we have to come up with these categories. So in general, autistic disorder is sort of the diagnosis that's been around since Leo Kanner identified the condition in 1945. It's fairly substantive impairment on all 3 of those domains: social, interaction, communication. And it's important when we think about communication that we realize it's not only verbal communication and delays in talking, it's also the nonverbal communication, very important. And then insistence on sameness or repetitive behaviors and activities. So fairly severe impairment across the board. Once we talk about PDD-NOS, what we're talking about is a kid who still fully fits on the autism spectrum, but probably doesn't have quite as severe impairment in those 3 categories. Asperger's, technically speaking, the diagnostic criteria for Asperger's focus on that communication domain and talk about how the communication impairment is not as severe. The Asperger's classification has been controversial from the beginning because folks have asserted that while kids with Asperger's often are talking on time and oftentimes are precocious, I mean, their language is very well developed at young ages, they still, if you look closely and carefully, have fairly substantive impairments in that nonverbal communication. Asperger's also has taken on, sort of in the culture, the idea that individuals with Asperger's are of normal or higher than normal intellectual functioning. But it's important to realize that individuals in all three of those diagnostic categories can actually have a range of cognitive ability.
And the atypical would be it's one of the smallest, or is it the smallest of the three categories in terms of the number of people in it?
It's really shifted over time, and I think what you're going to see, and as we talk about the new criteria, is sort of this idea that rather than focusing on the subtypes, we'll place individuals in an autism spectrum disorders diagnostic category, and then we'll try to think about where they fall on the spectrum in terms of severity of impairment. Well,
in a discussion you and I had, you mentioned, was it the American Psychiatric Association is developing these new descriptions of the autism spectrum? And that scares some parents.
Yeah, certainly it does. I mean, change is always scary. The APA is in charge. They are in charge of maintaining this document called the Diagnostic and Statistical Manual, which is sort of an unusual name. But basically, it's the guidebook for making diagnoses for psychiatric and behavioral conditions. And they're looking at every few years they look at revising diagnostic criteria across the board. And so they're looking at autism right now. They're going to go in the direction that I alluded to. There's going to be one diagnostic category for autism spectrum disorders, but then individuals are going to be rated on their severity of impairment.
And so physicians, clinicians, everybody involved in this will still try to look at the individual child and not do a one-size-fits-all, even though there's going to be one overall category.
Absolutely, and it's still going to be driven by looking at core impairments in social interaction.
Are there insurance ramifications for this?
I mean, I don't think so. I mean, it's still the diagnosis. I think that parents and the community is always concerned that maybe something is going to change with my kid, and that's a legitimate concern. But I can tell you from looking at the way the criteria are being conceptualized, and it's not final right now, it really matches very well what the way knowledgeable clinicians and researchers have been thinking about autism for the last decade. So I don't think it's going to be a major sea change.
All right. We'll talk more in a moment. Still ahead, what we know about the symptoms of autism and more on In Focus. Stay tuned. And as we said, it's more in some states like New Jersey. They believe the rate is higher there. Good morning. I'm Steve Highsmith. This morning on In Focus, we're talking about a new Autism Institute in Philadelphia being officially opened this year. With me is Dr. Craig Newschaffer, professor and chair of Drexel University's Department of Epidemiology and Biostatistics at Drexel University School of Public Health and director of the AJ Drexel Autism Institute. Nothing could happen without money, and so this has been a quick, in terms of academia, but a long startup process because you need funds to do it. You got a big donation last year.
Yeah, we did. We actually just quite recently we received we had the formal announcement just a month or so ago. We received a great gift from the Charles Close Foundation, and that gift is what we hope, of course, will be the first of many that will support.
That was the big one. That was like $1.5 million.
Yeah, it was. And while that's our first substantial gift from foundations, I also want to say that the university has dedicated other sources of internal support to get the institute launched, and we're very grateful for the leadership that President Fry has shown in sort of trying to get Drexel positioned at the forefront of this very important area. I
mentioned earlier the EARLI study. What is that?
So EARLI stands for Early Autism Risk Longitudinal Investigation. It is one of the largest epidemiologic studies ongoing to try to understand the complex causes of autism. EARLI really focuses on the interaction between genetic susceptibility and non-genetic factors. It is a 10-year research project, and we're about 4 years into it. So we've just started doing some preliminary analyses, but we're still a couple of years from really doing the kinds of analyses that we hope are going to answer some of these questions.
You, having been involved in this for a long time and dealing with it every day, you know, the parent will come to you and say, I don't understand something. How could we, even if autism has always existed, how could we have a situation where all of a sudden so many children are affected by it in the last 6 or 7 decades and not think that there is an environmental component of some type, whether it's genetic based or a predisposition, that there's something that triggers it? And obviously that's rushed a lot of research or calls for research into the vaccine area. And so what do you first of all say to a parent that says, there's something out there that my son or daughter is ingesting or something's happening?
Well, I think that many of us have believed that kind of instinct is probably true. For a complex condition like autism, just like complex conditions like juvenile diabetes or heart disease, it's very likely that there are both genetic and environmental factors. And it's true that in autism there was a little resistance, I think, to acknowledging that there was an environmental contribution. And I think that that's just sort of a byproduct of the history that our understanding of what autism is has taken.
So you don't think, for example, that it is 90-something% ascribed to, well, we're just doing a better job of diagnosing it?
Well, it's different when you're talking about what explains the secular trend. There's what are the causes, and then there's the question of what explains the secular trend. And you're absolutely right that those questions have been connected, right? Because if the real risk of a condition is rising over a fairly short period of time, like even decades, as opposed to over generations, the implication is that there has to be something in the environment that's contributing to that risk. So with autism, so the big question with this rise that we've seen and the CDC numbers have underscored is, is that real risk? And that's a very, very hard question to answer, because we know that there's been all this increased understanding of what autism is, a lot more awareness. So we suspect, anybody would suspect, that some of this is due to that. What gets very, very hard is trying to estimate, is 100% of it due to diagnostic awareness shifts? Or is there some piece of it that could be real risk? That is a nearly impossible question to answer. But just because we have trouble addressing that doesn't mean that we're not more confident that there are environmental causes. The work that's been going on over the past couple of decades to try to understand the genetics has painted a very complicated picture, and a picture that leaves a lot of room for environmental contributions working together with genetic influences.
So the new institute, as it really ramps up in July in an operational phase, will you look at these different areas? Will you explore genetics? Will you explore different potential environmental factors?
So we are not going to place a big emphasis on genomics research per se, because there are a lot of other groups around the country that are doing that. What we're going to do is we're going to try to do projects like the EARLI Study that collect the kind of data that you need to look at non-genetic factors.
That's what a lot of people have been waiting to hear. They want an institute that says, okay, we're doing the gene research, keep that up, but at the same time there's something triggering it, and you guys need to do a better job of tracking when this kicks in, and then obviously by that hopefully finding what it is.
Correct, and that's where emphasis is going to be, but it's important to underscore that you can't ignore the genetics.
No.
Because what you probably have is this susceptibility background that varies. So we need to, in studies like EARLI and in other efforts that we'll do in the Institute, we need to collect the kind of data and samples that allow us to assess the genetics. But we'll rely on our colleagues at other institutions here in Philadelphia and around the country to do that work with us.
Let me just show you some symptoms here, because there are so many that are on the range here.
Sure.
But you mentioned something earlier that just don't think about that verbal communication.
Right.
And so, for example, no response to name. That may not be a verbal response. Right. Delayed speech, that is, obviously. Doesn't smile when smiled at. Seems to be in his or her own world, walks on his or her toes, or others like doesn't wave bye-bye. I mean, do you have things, any of these things can panic a parent for no good reason. Yeah. But are there other things that you should say, you know what, don't worry about it, but get it checked out? Yeah,
it's very hard because that list is, there's nothing blatantly inaccurate about that. Yeah. That list is potential warning signs for autism.
But might not apply to any one kid.
That's right, and there are plenty of kids who are perfectly typically developing who at times will show behaviors like that. So it is very, very challenging for parents. It's better to be safe than sorry. There are also some great resources out there. The Centers for Disease Control and Prevention, for example, has an excellent website called Learn the Signs, Act Early. There's also web resources called First Signs, where parents can go and get sort of a more detailed layout of those kinds of signs and symptoms and try to assess the full package on their own, so they're not just responding to one thing. I think that in response to your question about, how can parents sort of think about this, a lot of what's going on, I think, with very young children is it's really the idea of joint social interaction. When is your child interested in sharing, positive experiences with you, and even at a very early age? Are they when their favorite toy comes into view, do they look at the toy and want to play with the toy, but do they also try to draw you in some way? And that's where a lot of that work that we were talking about before, where researchers are trying to find ways to measure signs at the very earliest of ages, is focusing on these shared positive social interactions. And it's a tough thing for parents to really pick up on.
Media can help and sometimes can inadvertently hurt when talking about various illnesses or how people deal with them. And I've heard communications over the years, for example, that autism is a quote-unquote communications disorder. That seems too glib a shorthand. But is it all right to say that, or is that too?
Well, it definitely affects communication, and I think if you were trying to expand the shorthand a little bit, and if you talked about social communication, I think maybe you're getting closer to what lies at the heart of autism. And there's been a lot of sort of debate in the field over what's the what comes first. Is it fundamentally a communication impairment that then obviously if you can't communicate well, it's going to affect your social relationships, or is it fundamentally a social? Right? And it's very hard to unpack those things, and in some ways I don't know that it's all that helpful. It's all of that.
Yes, it is. Thank you. And we'll continue more in a moment. Ahead, more on the AJ Drexel Autism Institute and the focus on research in a moment on In Focus on PHL17. A lot of support from the School of Public Health. In Focus continues with Dr. Craig Newschaffer, the AJ Drexel Autism Institute Director. Congratulations again. This is an awesome task, one that I get the sense that you're really embracing, not only obviously for the challenges of it, but because of just the importance of it.
Oh, absolutely. I mean, I've been doing this work for a decade, and the idea of assembling a team that's committed to the public health approach to autism research is very exciting to me, so I'm looking forward to it.
Those ground results that will come out of this when it pays off is going to be worth so much of that hard work, so don't give up.
Thank you.
Keep going. Well, let me ask you though, do you think that, and don't give me the correct answer, which is it's a combination. But do you think, is it more like we're going to find that there's a medicine to fix what it is, or is it a therapy that fixes what it is?
Well, so far our successes have been in the therapeutic end of things, and I think behaviorally based interventions clearly work. And I think that there's work to be done refining those strategies and also really tailoring, because we don't have a great understanding about which kids are going to respond best to which kind of educational or behavioral approach. So there's a lot of work that needs to go on there. I do think I do think that there are going to be some more targets, therapeutic targets, medications, pharmacologic treatments that really are going to help us deal with some of the core impairment in autism. Will these be proverbial magic bullets? Probably not. But a lot of what we're learning about the brain and about the complex genetic pathways that form the brain suggests that there are some targetable or actionable mechanisms that maybe drugs can be developed to help with. So I think that we can look forward to that over the coming decades. Some more autism-specific pharmacologic therapies in addition to the behavioral interventions, which we know work as a class, and we have to get better at refining them.
Is any of the research going to focus on folks who were not caught early, but maybe adults now?
Oh yeah, absolutely. That's going to be a priority for us. I think that if you think about if you get beyond that secondary prevention and you think about tertiary prevention treatment, what can we do in the community to make an impact? One of the major areas is thinking about service approaches for adolescents transitioning to adulthood and adults. We have to understand what the predictors are of good outcomes in older individuals with autism. We don't have the basic descriptive research base for that, and that's something that the Institute's going to focus on. And in addition, we want to try to help some of the agencies, the Bureau of Autism Services here in the Commonwealth of Pennsylvania, been very committed in developing novel service approaches for adults and adolescents with autism, but we need to get in there and evaluate those and try to help these agencies fine-tune their approach based on evidence.
Do you ever feel overwhelmed, though, when you try to find triggers that may be environmental, truly in the sense of what we think of the environment, whether it's air pollution or whether it's pesticide poisoning or anything else? How are you going to be able to do those kinds of tests of things that seem like they may take years to have impact or can't be touched?
Well, boy, that's a great question. And I think that, right now we do need to take sort of a discovery approach to understanding these environmental factors. In other words, we're best served by being very broad and sort of thinking that everything is potentially on the table, and that is quite daunting. I think that there are a couple of ways that we can get advances there. One is through biomedical technology, right? In 50 years ago, the idea of being able to study the full genome was a dream, right? And we've come a long way very quickly. The idea that maybe biomedical technology can help us come with more efficient ways to measure in biologic samples that we collect from folks the cumulative panel of their exposure history, right? This is something that we can't do right now, yeah. but it's a type of research that I think is very important for autism science, and I think is important for other diseases that have environmental contributions as well. And we'd like to push on that a little bit in the Institute. The other thing that we hope to do to try to is the more traditional approach of, look, we don't do our studies in a vacuum. There's lots of other colleagues doing neurobiology, right? If they have breakthroughs in terms of what the pathways are in the brain that cause autism, we can then say, all right, now that we understand this pathway is important, what do we know about environmental factors that mediate that pathway? And then we can shift our focus.
Well, that's fascinating, and it's an exciting time to be at Drexel, to be at the Autism Institute that's starting up, and good luck in assembling all the team. And may you work quickly and effectively.
We are going to try.
Doctor, thank you very much, and thank you for everything you've done for the last decade in addition to that. That's great. And our best to everybody at the Autism Institute. Now, for more information, you can go to www.drexel.edu. That's the umbrella website, of course, drexel.edu, and search for autism. And as time goes by, you'll be getting more and more. And that's In Focus for this week. I'm Steve Highsmith. Thank you for joining us. Have a great weekend and a wonderful week ahead.